My name is Thelma Kestner, and I am from Southwest Virginia. Whether it be to clean my teeth, get X-rays, or even just basic services, it's like I do not have to pay anything for those basic services because it is all covered, and that has benefited me so much as a young person um who's mostly focused on school and doesn't really have like a job of any sorts. Going to an office regularly and then being told, "Oh, your insurance doesn't cover this anymore," is quite debilitating considering that, oh, number 1, that's been taken off our feet, and number 2, we have to find somewhere else to make sure that they take Medicaid. But, like, when as someone on Medicaid who needs to go see, like, a physical therapist or, an OBGYN, I have to go either like 30 to 45 minutes north or south either way just to get care. And that is like gas and that's time. That takes and gas and time in this economy are a lot. And it's just distance and just being denied care at certain offices because they don't accept it is can be just like I said, debilitating and also just frustrating because why can't you take these? And also having access to care in somewhere so small, it's it's hard because you have to travel a lot, and even it's hard. You have to travel a lot. And even then, it's just where I come from such a secluded area. It's like sometimes even my mom, when she was having such like terrible back problems, she'd have to go all the way to Roanoke just to get like care, or even Charlottesville. And there, it's just like and I think the reasonable thing is that there should be no need for that. There should be a local accessible care for everyone. You don't have to travel 4.5 hours just to get care. Like for example, the big beautiful bill and all those Medicaid cuts, those are happening. Those will affect Southwest Virginia. That will close 2 hospitals. That will close one in Pennington Gap, which is in the corner of Virginia, and one in Tazewell, which is, um, which is kind of right up above where I live. And first and foremost, people who live in Pennington Gap and Lee County in that area, they cannot it's like it's gonna be so much harder to find, like, a hospital, whether it to be, to, like, an ER like an ER visit. It is a little more accessible. The way you have to get through it, though, is through literally mountain. It's like you have to travel a mountain road, and that enough that road already is just it's vile. It's not in the best condition, and it when even when you go on that road, you're still miles away from the hospital in Marion, which is the closest hospital to Tazewell. And just even then, like I said about Pennington Gap, you'll see all these you'll see the death tolls rise. You'll see just like proper care won't be supplied to Southwest Virginia residents as it should be. The youth of Virginia needs to be like educated on like what their rights are, and having those rights easily accessible anywhere, anytime could significantly benefit them. And those are just like some of the very few things that would be like a youth-centered Virginia that could like benefit all of the youth. These cuts are going to be extremely detrimental not only to Southwest Virginia, but the entirety of Southwest Virginia. There are, I would say, there are a few hospitals that are at risk of closing because of these Medicaid cuts, and that means that the people who you represent are not gonna get as adequate healthcare as as which they deserve, or as which, the state of Virginia should provide. Earned dignity really means actually listening to the youth of Virginia when they come to representatives for issues.